Like I mentioned before, we're really grateful to be joined today by Kai Tao, the founder of Juno for Me, and Tanisha Winston, nurse practitioner at Chicago Student Wellness. So if you all could start with your opening statements, introducing yourselves and your pronouns, describing what you do at your organization, and also cover a wide range of questions that usually are what people think of when they're frequently asked questions of birth control methods. So what birth control methods does your organization offer, and what is the process of obtaining birth control at your organization? Does your organization offer sliding scale pay, financial assistance, transportation, or other aids? Does your organization offer free or low cost birth control consultations or birth control with no copay, depending on insurance? And specifically for Tanisha, if you could talk a little bit about USHIP and the UChicago Student Services fee. I know that was a lot of questions, but whoever wants to start, feel free.
I'm happy to start. Good evening, everyone. My name is Tanisha Winston, and my pronouns are she, her, hers. And I'm happy to be with you guys today. I've been with the University of Chicago for approximately 2 years now, and it's been a pleasure to service all the students. Just a little background. Prior to coming to the University of Chicago, I was at Rush University Medical Center for approximately 8 years as a family nurse practitioner. And so I really gravitated to women's health and providing contraceptive services and confidential STI screening and things of that nature, reproductive services. And so specifically at the University of Chicago, I like to say that the USHIP covers all of the available contraception options. The only thing is that there are a couple hiccups when it comes to like the more long-acting reversible contraceptions, which would be Nexplanon implant and different forms of IUDs. So specifically, we are able to start that process at the Student Wellness Center. However, the actual procedures are performed over at Gyne at University of Chicago. And so it'll be a one-stop where we kind of do an intake. We'll do a pregnancy test at University of Chicago Wellness Center. We'll place a referral, which will cover any fees that will be associated with that. And then you will schedule an appointment with the Gyne department and they will perform the procedures. What I would like to say specifically is that even within the pandemic, we've been abreast in performing a lot of contraception counseling and management. Specifically with the telemedicine form, we're able to kind of do contraception consultations and management. For example, electronically, if individuals are already on specific contraceptions, they can request those same contraceptions. We're able to kind of get their pharmacy on file and send it over to the pharmacy. At University of Chicago, we also pride ourselves in trying to make it as convenient as possible and maintain student wellness. So we try to refill and give students like a year's supply of their contraceptions, whether it be the pills, the patch, of course, Depo, you come in more like every 3 months. So I think coming from a lot of institutions, University of Chicago has a great integrated system where not only we're able to provide all the available contraception options, but we're also key in contraception counseling, which helps the patients make an informed choice about which birth control option will be best for them. And I'd like to think that we give the patient an opportunity to help with why they want to start contraception. As we know, contraceptions are great for protecting against pregnancy, but there are also some off-label indications for certain contraceptions. For example, it could help with regulating periods, it can help with heavier periods, some women with acne. So we try to kind of get the best information as to why individuals want to start birth control and give them the availability of all of the options. And then we kind of collaborate with the patient to help them make that decision. I want to make sure I covered everything. If there's anything I left out, please feel free to let me know.
No, yeah, that was wonderful. Thank you so much, Tanisha. Kai, do you want to talk a little bit about what you do?
Of course. Hi, guys. Good evening. My name is Kai, like Hi by Y Kai. Go by she, her, hers, and happy to join you guys. It's always fun to meet with more people, especially during quarantine time. I am a certified nurse midwife by clinical training. I still deliver babies on the weekends at Northwestern, but my day job has always been in public health and women's health and reproductive health. Spent some years as VP of Clinical Operations for Planned Parenthood of Illinois, and then was at Medicaid, state Medicaid, kind of really looking at some payment levers to say, hey, how can we make it better for more women and their families to access preventative services and well woman exams, and of course, follow up on any concerns that we find there. And then I was the Deputy Commissioner of the Chicago Department of Public Health prior to starting Juno for Me. Juno for Me was born out of really hearing from providers in the community and hearing from people, but I often say more young people, young kind of in the 15 to 24 age range, hearing that, they were not sure. They had heard about the pill, which we know is the most ubiquitous birth control, hormonal birth control in the United States. They had heard, been maybe offered a depot, but they weren't sure what an IUD or implant was. And if they weren't sure where to go, they weren't sure who to trust, and they weren't sure if they can afford it. So that was primarily one of the main impetus for starting Juno for Me originally. And this started in about 2018, where it went into action, went live. And essentially what we are now, it's morphed a little. We are a digital platform, so we don't have any bricks and mortars. You're not going to find our office, even though if you Google it, Google thinks it's smart and it'll bring you to my administrative office, which is always a disaster. But what we do is connect users to any type of birth control to providers in the city of Chicago who are really good at doing birth control, because this is what they do day in, day out. They are very comfortable working with people who, whether you're young, maybe at risk of homelessness, maybe, very having all sorts of other psychosocial issues. As you guys know, we're just not our uterus or our cervix, right? We are a holistic, we have so many other issues. So we connect users who are thinking they want some kind of birth control, but they're not sure where to go, who to trust, and if they can afford it. I think one of the other things we really found out that was critical in providing this platform was healthcare is super confusing. I always say it's almost like a second language, right? I read about your U-ship and looked at United Healthcare and looked at all the exclusions, the policies, in-network, out-of-network, your tiers, right? Your university one actually somewhat straightforward compared to some of the ones, especially on the marketplace, some employer insurance, meaning you're never sure what you may pay. And we all know when we sign that fine line when you're at a doctor's office, like ultimately I'm responsible for it. And that can be daunting. And so we wanted to make sure that you never have to pay out of costs. And so that's what Juno for Me is. You can get any birth control. If you have insurance, awesome, and it covers it, awesome. If it doesn't, don't worry about it. You're not responsible. And currently we've been offering a free Lyft ride to and from the clinic. So you get a free Lyft promo code. So you do have to agree to the terms and conditions on Lyft on your own. But from there, you get a promo code. Fax, hello. You can see what generation I'm from. Text or email to you about 24 hours before your scheduled appointment. And that is good for $35 each way, $70 round trip to and from the clinic. So yeah, that's what we do. Our providers are throughout the city of Chicago. Right now we're in a sort of a transition, like many things. COVID threw all sorts of things out of whack. We're trying to reset. And we're also, as I like to say, becoming bigger and better. We're building back better. Is that somebody's line? We're building back in that we are going to be expanding our network. So there's going to be more health centers. And thinking about some more innovation of using digital technology, meaning maybe having something, a direct door to delivery service as well for those who are interested in the pill, the patch, the ring, the depot sub-Q, or emergency contraception pills.
Amazing. Thank you so much, Kai. Thank you so much, both of you, for all that incredibly helpful information. We'll get into more of those topics as well. I'm also going to introduce Marta Buramendi-Conde, who's an InTouch PHA, who's here with myself as student panelists to talk a little bit more about our experiences with different types of birth control methods, seeking birth control, experiences with family, things like that. So Marta, could you introduce yourself and your pronouns? Which birth control methods have you used or do you use, and why you wanted to be part of the birth control panel today?
Yeah, so my name is Marta Buramendi-Conde. My pronouns are she, her, hers. I'm currently using birth control pills, but I've previously also had the Nexplanon implant. The reason I wanted to be on this panel today was because I want to help spread the message that exploration and what is good for yourself and your body in terms of your birth control is nothing to be ashamed of. I feel like, especially, I mean, we're in an environment where it's still difficult to talk about women's health issues and birth control. So I kind of wanted to help promote on campus and also just general community environment where we get a little more comfortable talking about what is best for us, exploring, like, knowing that you can kind of, make mistakes and realize that you can change birth control methods, and people should be more comfortable talking about it.
Thank you so much, Marta. I can answer this a little bit since I'm sort of moderator and panelist. My name is Alex Hayward. My pronouns are she, her, hers. And I used to be on Trilomarsia, version of the birth control combo pill. And now I'm currently on the Nexplanon implant, so backwards of Marta. And I wanted to be a part of the birth control panel. And this is a project InTouch has been working on for a long time. Because I feel really passionate about democratizing resources that educate on different types of birth control methods, as well as normalize conversations about exploring different types of birth control, like Marta was saying. I grew up in an abstinence-only policy school where my health teacher told me that if they put a condom on a banana, that they would get fired. And I'm also half Filipino, and often in Filipino culture, any conversations about sex or intimacy are really stigmatized. And so the narrative was very much don't have sex at all growing up. And it really put myself, my siblings, and my peers at school at risk, and just not knowing about our own bodies, about how to have sex in a way that prevents pregnancy, if that applied to them, and just generally like have any resources to talk to you about these types of things. And so there's like a famous story in my family of my mom like finding out that my sister had gone to Planned Parenthood to try to get birth control on her own, and got so mad because she didn't know what that meant and thought she was pregnant, which made no sense. But yeah, I just only want to help young people not feel the same confusion and fear and shame that I felt about seeking birth control and wanting to explore it, and about my own body ultimately and my sexual health, which is why I'm really excited to talk a little bit about my experience as well as moderate this great event. So I think that we can jump right into some of our other questions before we move on, like I said, to audience questions later. I also wanted to reiterate again for new folks here to drop your full name and house in the Zoom chat box in order to be kept track of for the Chicago Student Wellness competition for house attendance. And just also wanted to mention again that if you text UChicago PHA 649 to 22333, you can join our anonymous Q&A, and then just text in any questions you have to that number after you've joined, if you'd like to send us in questions that way. Okay, so to Tanisha and Kai, what are some common myths or misconceptions you hear about birth control, and could you debunk them for us? I know I hear a lot, for example, that hormones are really bad to put in your body and things along those lines. Could you talk a little bit more about what you've heard over the years and how you can debunk them for us?
How about I start this time? All right. So, there is so many myths and misconceptions about birth control. I do want to always point out that, there was some historical reasons for why there are some birth controls that may have had bad raps today. So let's just start with, there's a lot of things, but some people may say IUD is dangerous. It may cause infertility, or it could cause infections. And why? There was something called the Dalkon Shield, DALKON. If you Google it, it kind of looks like a little crab. It was, one of the first kind of longer forms of birth control that came out right soon after the pill. And back then, women were feeling like, wow, I feel liberated. You mean I can actually have sex for enjoyment and not get pregnant possibly every time, or have the fear of pregnancy every time? And so that came out, the Dog-Cone Shield, and a lot of people said, this is amazing. I'm excited to use it. I want to try it. Well, unfortunately, the filament, the string to the IUD, so the intrauterine device, was poorly made, and it actually caused bacteria to adhere to that string and ascend up into the uterus, which then, of course, as you can imagine, if you're getting infection within the uterus, that could be bad, related to pelvic inflammatory disease, right? And then sepsis and infertility. And because of that, there, that was kind of in the 70s. I think there are still some people who truly had bad experiences, whether it be a maternal grandmother, a great aunt, right? Depending on what age we're looking at, that said, oh no, IUDs are bad. And then suddenly you grow up, just like you were mentioning, Alex, maybe nobody talked about it, or if they did, it was just, it's dangerous, it's gonna cause infertility, right? And so I think that's one of the common things that we think about birth, that we hear all the time in birth control is, well, if I take birth control, what if I can't have babies later? And my best way to explain that is, infertility, general infertility, when you look at population health, is about 10%, 1 in 10 couples, right? Meaning we need 2 partners, at least from the data that we have, may have some kind of underlying infertility. And so it's very normal. I just said, right, the pill is probably the most common. Someone takes the pill, they use it for 6 years, 8 years, they get off because now they think they're ready, or they're wanting to try to get pregnant and they can't get pregnant. And it's very normal to make that correlation, right? It's clearly not a causation, but to be like, oh, well, it was the pill that I was on, that's why I'm infertile, even though we know about 10% of couples will have some kind of infertility. So I tangent a little, but that's one of the myths and misconceptions. Maybe I'll ping pong back, popcorn it over to you, Tanisha, and then we can kind of go back and forth. Does that sound okay with you, everyone?
Sure. And so that was great. Actually, one of the myths that kind of comes up a lot is about the infertility as well. And I would, echo exactly what you're saying, is that it's not a causation, but more or less infertility is, one of the things that couples do struggle with. Like you said, approximately 10% of the population. More than anything, I also took care of like younger patients. And so specifically, there was some stigma around starting birth control, and individuals who would know about them starting birth control would associate that with them being more cavalier with their sexuality and having multiple partners. One thing that I want to mention is that, like I said before, contraception can be used for multiple reasons, specifically one being regulating your menstrual cycle. So to know that contraception can be used for many reasons. And then more importantly, I like to think when we talk about contraception and how it relates to the male partners. So for some people, they associate like sometimes the IUD strings or NuvaRing devices that go inside of them, that their partners will be uncomfortable with sexual practices. Just kind of educating them along the lines that, like, usually that doesn't happen. In any event, placement things are an issue or strings are too long, they can come back into the office and we can kind of help with that. One other thing that comes to mind is contraception as it relates to, in the past, racial biases around people feeling like birth control can be used to make them infertile. Birth control can be used as punishment. Is birth control real, or is it safe? Are the hormones messing with them? And so I recognize, and I share with patients who may have such concerns, that I recognize that their experiences or their family from generations in the past experiences may have been real, but just kind of assure them that we do our very best to practice ethical care and to allow them to know that even long active contraceptive methods such as an Nexplanon implant or IUDs, although they're, relatively expensive and they're used in a way they should, or they're recommended to be used in a way that's long acting. At any time you decide that it no longer works for you, you do have the right to take that device out of your body, even if it's within a month time. So those are a couple of things that I want to add to it.
I think, the other top 2 things that I often hear is, will it cause me to gain weight? We hear that quite often. From all the literature that we've seen and research, the only one that has shown maybe an increase in weight, again, not a causation, but increase in weight, is from using Depo-Provera. Depo-Provera is a shot. It's progesterone only. It's usually every 3 months you get it. We say 12 to 15 weeks, but average 3 months. It's either subcutaneous, so just right underneath the skin, or it's an intramuscular shot. This has been shown in about a third of the population to change your appetite. So you can imagine a third will have an increase, a third will have a decrease, and a third will have no change. So it's that third who has an increase in appetite. It's what you do with that appetite, right? I know if I, drink more water and eat an apple and a banana, I might be satiated, or I can have 2 cheeseburgers, right? And so that's where we've seen some people, and really the weight gain that when I get concerned is it's interval weight gain. So I may see the patient and 2 pounds weight gain here, 3 pounds. That may happen over the holidays, and that's okay. Or you were not feeling like exercising. That's okay. It's when we see something like, I have seen patients who actually have that response. We're seeing like 8 pounds, 15 pounds weight gain interval in between those shots. So that's when I would really say, hey, that might be an issue. But then why else do we hear about weight gain? Well, what happens to everybody with time? As we age, what happens? Everyone can, whether it's for yourself, a family friend, it's going to happen. Our metabolism changes. How I ate at 13, I cannot, take in 5,000 calories when I'm 23 and then at 33, right? So that's just a normal of the normal physiology. But for a lot of young people of childbearing age, you guys, young people, you may be totally healthy otherwise. And the only intervention you're getting is birth control, right? Meaning a lot of you, hopefully not yet, knock on wood, never, but diabetes, hypertension, heart disease, the most common things. You're not taking meds for anything. So what are you taking? Whether it's the implant, a pill, you may think that's the correlation, because why am I gaining weight? I'm 19, I'm 20, 21, and I've been taking the pill. Maybe that's causing me to change weight. I may increase weight. So that's a very common thing. That's a myth and misconception. Anything else, Tanisha, or I can bring up one more?
No, I think you hit most things. I was thinking about Delp one, like weight gain association.
I think the last one that I hear often.
I'm sorry to interrupt, but it's probably yours. The mood changes with some of the hormonal contraception. So I was going to speak to that. Some individuals may benefit from different contraceptions or notice that they may have changes in their mood based on like specific hormones, whether it be the pill specifically. And those changes may be very real. And what I share with patients is that we sometimes they take their experiences that like their family members or their peers had and think it's going to immediately or definitely affect them. And I let them know individually that hormones can affect everyone differently, even in the same family. And sometimes we almost kind of like a pair of shoes. You may have to try a few one on before you get the right perfect fit. So I'll let you kind of end.
Yeah, and I think the last thing for me is really thinking about, what are some other myths and misconceptions? We think about cancer, right? People say it will cause cancer. And oftentimes we have these personal stories of people saying, my aunt was on birth control and she ended up having ovarian cancer. And, I think the most important thing is for us, to hear out the patient and then provide them with the facts and evidence. And that's what we try to do as, for me, the providers that we work with, because everyone has their personal experience and what they're hearing and learning from their family and their network. But then to try to provide the facts, not to convince them otherwise, but at least provide the facts. And, I think what's really amazing about a lot of these combined pills, whether it's the pill, the patch, or the ring, which are estrogen and progesterone, and even the IUDs, we have seen good enough literature, robust enough literature to say it's actually protective of ovarian and endometrial cancer. It's so good that if I have a patient in front of me that says, I have a family history of ovarian endometrial cancer, I might even recommend that, having nothing to do with pregnancy prevention, but as a protective way to prevent ovarian cancer. But you have to use it for up to 5 years is what the really studies have seen. And then last thing really quick, you'll see in our Dropbox chat box here, Angela Townsend, who is our community program manager with Juno for Me. They recently worked with some folks we worked with Chicago Public School, but with MICFA and Girls Inc. to create a video. It is kind of for the younger side, but I think it's always fun to see. It's about debunking myths, and we just put that out. So it's a quick little tidbit, but it's kind of fun, and it's good to see what's happening in your community from youth in Chicago.
Incredible. Thank you, Angela, for sharing that resource. Everyone should definitely go check it out. It's in the Zoom chat. And thank you for such in-detail answers to debunking myths and things like that. I had planned a follow-up for this, but you both covered it a lot. So if you want to just have one note about side effects or not, or just move on, that's totally cool. I was just going to ask, can you talk about the side effects of different birth control methods and how they differ from person to person based on type, positive and negative side effects that you think a lot of people might not know about, like you were mentioning, Kai, at the end there. I know you touched on this a lot again, so anything else to add, and let me know if you'd like to move on, anything like that.
Go ahead, Tanisha, if you want to go first.
So sure. So different side effects, as I explained before, like side effects are kind of specific. When we think about certain side effects, specifically, I think about the patch. I know for some people, they may initially, when they first start using the patch, get some skin irritation. And that's usually kind of goes away. But sometimes individuals are like very hyper aware of everything that happens. And so I explained that patients can stop using birth control at any given time, but when starting a new birth control, oftentimes it's helpful to kind of give it at least a couple months to see how you truly respond, if it's a true effect or if it's just something that's a sensitivity that kind of goes away as your body gets sensitized to it. One other thing that I can think about as far as Kai did a really good job of talking about like depot, and sometimes individuals kind of may be at risk for gaining weight, and it's just a certain percentage, and it's not necessarily they're gaining weight because of the depot, but like the appetite. Specifically, individuals I have I don't know specifically if Kai, you have saw this in practice or saw the literature, that some people expel IUDs for whatever reason. It's not a large population, but some people, for whatever reason, have expelled IUDs. And so sometimes it's not necessarily a side effect, it's just more or less their body rejects it. And so those are a couple of things that comes to mind that I would like to kind of elaborate on, and I'm sure Kai will kind of follow up.
Yeah, so that's interesting. So, maybe talking kind of about IUDs and implants, we've touched upon them. There are two types of IUDs, right? One with hormones. There's all different brand names. It's all progesterone only. And I always like to say, and Tanisha used my perfect analogy, it's like shoes. It all does the same thing. If you're looking for sneakers, and I don't know if that puts me in a certain demographics when I say sneakers, it all does the same thing. They're overall comfortable. You might have some slight variation, meaning, this heel feels a little too wide or the arch is a little different, but it all does the same thing. And that's exactly what I like to say about progesterone IUDs. They're all essentially the same. Marketing, whether it's the company saying, hey, well, this one's for 5 years for the person who thinks they want to wait longer. This one's for the person who wants 3 years. And guess what? It's about 2 millimeters less in diameter. So it's going to be more easier insertion. I've been doing IUDs for about 20 years. I never noticed a difference. It's so much about the provider. And yes, there is that strong placebo effect. So if we're going to appreciate that, if someone believes it's going to maybe be less painful, then it might be less painful. So I do want to put that out there. But, it's primarily marketing. So I would not, if you go to your provider and they say, oh, all we have is the Mirena, all we have is the Skyla, the Kylena, or the Liletta. Those are the 4 progesterone. They're all essentially the same. I wouldn't, try to fight your insurance or anything for that. And if it's the 5-year one you get, but you want it out sooner, just take it out sooner, like Tanisha mentioned. But what I want to mention as an expected normal side effect is bleeding profile. So much of what, whatever birth control you have, we talk about informed consent. That you want it, but the informed consent, you understand what you're consenting to. So a good provider, which I know segues into a little bit, Alex, with the next thing, is, that your provider actually explains this to you. Doesn't just say, oh, you have any questions? And you're sort of mid-thought and they're like, let's do it, right? That you really understand. So progesterone IUDs, you will have irregular spotting early on. Irregular spotting or bleeding. Notice I don't use the word abnormal because it's expected and normal to have this. So it's irregular, non-cyclic bleeding early on. With time, for a lot of people, they may not get their periods at all. And I always like to explain that could be perfectly normal and healthy. Why don't you get your period? Because what the progesterone does is really thin out the lining of your uterus, right? Every month, if you don't have any hormones on board, we call the symphony. Everyone can remember their human reproduction sex ed class between LH, FSH, estrogen, progesterone, right? Some rises, what have you. So that symphony of hormones, if you're not getting pregnant and if everything else is sort of in check with your regular cycles, you get this buildup of tissue. Well, and then if you don't get pregnant, that tissue sloughs off and that's your period, right? But with progesterone type of hormones, that tissue never has a chance to build up. So that's actually why then your periods early on, or what seems like your periods, are kind of irregular as your body's adjusting. With time, it thins out completely. So a lot of people, and I'm explaining this with the implant as well, very similar implant, because it has progesterone as well, may not get their periods. And if they do, it's just light spotting here and there. And it's impossible to say who that's going to happen to. So if your doctor is saying, oh, this for sure will happen, that's probably not quite accurate. We think for the majority of people, you're going to get irregular spotting, and then with time, no periods. But that can vary across the board, and that can all be normal. And then just really quick, the other one, when we're talking about at least the IUD implant in this case, the Paragard. That's what most people know as the copper IUD. Again, no hormones on board. And so it's a great for some people who says either I can't take hormones or for whatever personal reason, they don't want hormones. However, they need to know that, you know, this Paragard IUD, which is a great product in that it's been out for a long time, is good for up to 12 years. Again, if you want it out after 1 year, fine. And the main expected side effect is heavier bleeding and possibly heavier cramps. For some people, they say, hell no. Other women say, great, that sounds like a great option. I can deal with that. I don't, you know, I can take my periods every month. You just take over-the-counter ibuprofen, and that usually totally helps it. Or ibuprofen, Motrin, whatever is your pharmacy of drug of choice for your cramps.
Okay.
I could go on, but I'm going to stop.
No, yeah, we are just want to make sure we have time for some questions at the end. Thank you both so much for your in-depth answers. The next question we have is, how does your organization most support those seeking birth control and advocating for themselves? What advice do you have for those who feel doctors aren't listening to or treating them effectively in the process of obtaining birth control?
I might start. And so at the University of Chicago specifically, we're really intentional about allowing students to have contraception counseling at any time. Again, with the pandemic, we also do telemedicine so individuals can have an in-depth conversation about what is available. And then me specifically, I like to also let the patient have questions and time to kind of take in all of the options and even do some research for themselves. Because as we both mentioned that certain birth control can work effectively for some and they love it. And then some, as Kai just mentioned, may have some side effects as common, or not even side effects, expected effects as common as bleeding, and that just may not work for some people. So I want to make sure that they have an in-depth knowledge base about specific all of the birth control options so that they can make an informed decision about which one they think will work best for them. And remember, I said think, because again, things change. You may run into something that you're like, I thought the pills were well, but my schedule is getting a little busy and I don't want to have that one thing to remember every single day. So a thing that works well is to kind of the reminder that we do follow up like once a month via the MyChart messaging in the patient portal. Just asking patients, are they comfortable with their contraceptions? Do they have any questions, concerns? Have there been any new incidents? And I find that that small follow-up allows, sometimes patients don't even respond because they're fine, but it allows them an opportunity to kind of think about how their birth control is working for them. So I think more than anything, the opportunity to communicate with the providers via just texting in the patient portal is really helpful. I find that patients really are responsive and ask questions and seek clarity. And then a lot of patients at the undergraduate level, not a lot, but some have a little experience with a specific birth control that's worked well for them over the years in high school, and they just want to stick to that. Even if that's the case, I still allow them the opportunity to make sure they're aware of all of the eligible contraceptions that are out there, and if they have any more concerns about anything that can benefit them in the future.
Great. I think, you know, Tanisha did a great job of covering kind of that shared decision making, and you should feel like you and your provider are deciding what's best for you, right? I think some common obstacles that we see, and, you know, we said doctors, your provider, it could be your nurse, it could be your nurse practitioner, your PA, your midwife, right? Your clinician, that, you know, you kind of want to be like, okay, maybe I need to go somewhere else, right? Is when they say things like, wow, well, you know, you're kind of young. Do you think you want to do this? Or you've never been married. Maybe you don't want an IUD. And I know that sounds crazy, but I hear from patients who've been told that in the Chicagoland area, and that's why they're coming. Whether when I was a provider at Planned Parenthood, whether, it's during a delivery, but afterwards they're like, oh, they're telling me their story of, they had once wanted this birth control, but their doctor here said, well, we see you have a history of chlamydia from 2018. I'm kind of concerned about putting you on an IUD. I mean, these are all things that, maybe the provider just, needs a little education, but really kind of checking our bias, looking at the facts and evidence and practicing evidence-based care. And so there is still that happening, not because they're bad doctors, but maybe they are bad clinicians, but maybe they just haven't, read the latest research or literature. So I think, and then the other thing is about age. In Illinois, we are one of the states, and of course, unless I have a child prodigy on this group right now, but if you're 12 and above, you can consent to 4 different services without your parents. And that is contraception services, STI, screening and treatment, substance abuse, and behavioral health. Those 4 things were passed in Illinois to say, if you're 12 and above, you do not need parental or guardian consent for the care. Which, a lot of people don't know, including a lot of providers. Hopefully most of you guys are in a supportive environment and have someone you can talk to that's, 21 and above, if that's the case. But if not, if it's a friend, a neighbor that you may know, I think that's important to know that, if you call and you're 18 years old or 17, and they say, well, where's your mom or dad? That's not necessarily required. And you might want to seek somewhere else. And then, confidential care is important. I'm not sure about how the insurance is with the students, but a lot of people are concerned about their confidentiality, right? I have insurance, but I don't want to use it because I'm afraid my ex is my parent, my boy, whatever it may be, right, is going to find out. So, Juno for me really tries to support that. So some people can have full insurance, but you can just say with one of the providers, I'm really concerned my mom would kill me if she knew, but I know I want to do this for myself. Then we can put you on a different type of payment scale where it's still 0, but you don't have to worry about it. You may have to fill out some paperwork because that's just the nature of healthcare, but we can work around that.
That's an awesome service. We used to have that at Rush, but at University of Chicago specifically, it's this U-ship insurance that's coverage, and we don't have like the Title 10 program that would support that. But I do referrals for individuals who fall in that category.
Great.
Yeah, I think that's a great segue to our last question for you, Tanisha. So what resources are available to Chicago students in exploring and obtaining birth control methods? Do you offer confidentiality for students during birth control consultations for prescriptions, like we know you do with STI testing? Can you outline the step-by-step process of finding a doctor to prescribe birth control to someone seeking birth control through USHIP or other insurance they might have?
Absolutely. So specifically at University of Chicago now, I'm going to give you guys this number and I'll put it in the chat. It's 773-834-9355 or 773-834-WELL. That number specifically will you can get in touch with the Student Wellness Center and the Student Counseling Center. And I think it's important to kind of note both of those. And so, there's a hotline number that you can always reach even after hours and on the weekend. Specifically with U Chicago, the majority of the students do have the USHIP insurance, and then there's a percentage of students who are with their partners or husband, spouse, husband, wife insurance, or their parents' insurance. The specific insurance varies, so I can't give detailed explanation about individuals who may be on parents, because some of those insurance are just so much in depth, and as Kai mentioned earlier, it's so many layers. But I can assure you that at University of Chicago, we do offer and support confidential contraception services. And even if you, as Kai said, state, I don't have the USHIP insurance and I'm on my family insurance or partner insurance, ex insurance, and I feel uncomfortable with them finding out, I am happy to refer them to, specifically, I was referring individuals to actually the Adolescent Family Center at Rush University, and they're able to talk to a previous colleague, and even if they do have insurance, she's able to kind of communicate with them and allow them to fall into a category where they don't have to worry about costs. And so that's been effective. Sometimes individuals are just kind of like, I want to tell my family, I just need a little support, and I'm happy to facilitate that. There's no pressure. I find that sometimes, as Kai said, some expected bleeding can happen, especially with some of the LARCs. And so sometimes when explained that possibility, they're like, what if it, it gets cause a little anxiety, and they want partners, families to know. And so they just need a little support in how they share that information. And I'm happy to support that as well. Another thing to note is that specifically, as I mentioned earlier, with the LARCs, the student wellness providers don't provide it at this time. There will be a gynecologist that come over and spend some time there to do that in the near future. But right now, the students do go over to the gyne department. It's a referral that's given in place, and we do that in advance. I just want to give you a step-by-step process. So for example, I'm a patient, I call the Student Wellness Center, that number, and you are connected with a provider. During a pandemic, we sometimes do a telehealth or telemedicine or a video virtual visit, as we kind of doing over Zoom. It's confidential. You give consent that you want to do a visit as such. Then we talk about your chief complaint, and specifically, I make sure that I meet all of your confidentiality around your name, your date of birth, and your number. Then we start talking about what you want your contraception to do for you. I go so far as to, if they know at the time, so if the patient is aware of all the options and they just want to start something out, I'm happy to send it over to the pharmacy. If one of those options, the Nexplanon or the IUD specifically, we'll put the referral in. I'll give you gyne number and help you coordinate your appointment. Specifically, you will come over to Student Wellness. We'll collect your urine to do a pregnancy test and recommended STI test, which will consist of chlamydia, gonorrhea, HIV, and syphilis. Those things are done. Your appointments over at gyne, then they can do the procedure. I kind of give a step-by-step procedural kind of things to anticipate, because I used to perform IUDs and Nexplanon over at Rush. And so I'm really happy to kind of give them some understanding of what they can truly expect. And even if they want to do some over-the-counter ibuprofen prior to the IUD procedure, sometimes that's helpful. Oftentimes, again, in about 4 weeks, we follow up via the MyChart portal to make sure your birth control is working for you. And then individuals can come in at any time if they want to change, if they want to communicate, if they're having problems. And then more importantly, I always let them know that at any given time they can stop their birth control or get a birth control removed, even if it's designed to last 3, 5, 7 years, so that they know that they're comfortable and they're not obligated to keep any device in.
Amazing. Thank you so much. Just to make sure we have time for questions at the end, we have a couple of questions for Marta and I as InTouch PHAs and students. The first one is for Marta. So for those, could you speak to your experience with your family while exploring and or obtaining birth control? Did your family play a role in exploring and or obtaining birth control? Were they supportive or not during this process?
Yeah, so when I first got onto birth control, it was when I was in high school, and it was on oral contraceptives, so birth control pills. I was privileged enough to have a supportive family. My mother had had experience with the pills in her youth, and she was very supportive with me throughout that process of talking to my doctor and wanting to get that prescription. She also was perfectly understanding of my reasons for doing so, and it was because I was planning on being sexually active during that time in my life. They definitely, I think, did play a role in the type of birth control I wanted to explore. So a few years after I started the pills, I did explore with the Nexplanon. That was more because of a friend recommendation and seeing that. But I think starting with the pills and going back to them after the Nexplanon, basically I had very negative side effects. I think that definitely my mom definitely had an impact in that. That was a method that she had more experience with and was more comfortable with, so she kind of pushed in that direction. But I think in a more general sense, I would definitely say that my parents were more supportive than most. So I would have to say I'm pretty privileged to be able to say that.
Thanks so much, Marta. Our last question before we get to audience Q&A is one I'll answer, which is, what factors did you consider when deciding which birth control method or methods to explore? Can you speak to your personal experience with the birth control methods you used or are using? What did you like? What did you not like? Side effects and experience in general. So I started, like I mentioned before, Trilomarzia, the combo pill, back in high school. And like I mentioned a little bit before, my parents weren't as receptive towards me in my journey to try to get birth control. So I actually was able to start using Trilomarzia when I first started being sexually active, but I kind of asked my parents if I could use it under the guise of helping with my acne, because I had really bad acne. So it did help with my acne, but I also wasn't completely transparent with them in that way. So it helped acne for me, and it also made my periods more regular. I was actually someone before trilomarsia who had periods every couple months, and then I started getting them on a more regular basis every month. I didn't experience anything like weight gain or anything like that, and no mood effects that I could remember. Things started getting a little bit more complicated for me in basically like about a year ago. I started getting kind of frequent UTIs, and the medication that I would be prescribed to treat UTIs that I would basically take for like a week would cancel out the effect of my birth control oftentimes, at least from what my doctor was telling me. So I really wanted to explore other more kind of like one and done, don't have to mess with it types of birth control. So I ended up switching to the Nexplanon implant last summer and have really loved it since. My arm, I got it at the Ryan Center at UChicago Medicine, and I originally learned a little bit more about Nexplanon from a telehealth visit with a urogynecologist who just kind of introduced me to what Nexplanon is and explored options for me to come in amidst the pandemic and get it, which I felt so grateful for. So that was a telehealth visit, and then I was able to go in over the summer to get it. And since then, I did experience that side effect where you just like get a longer period for the beginning. But that was very expected. Like my provider let me know that that was completely normal and things like that. And I haven't experienced any other side effects and really loved it because I also started forgetting to take the birth control pill as one does when they get busy. So it really just gave me like a peace of mind that I don't ever have to worry about it, don't have to take something at the same time every day or close to the same time every day. And it just really worked for how busy I got during college. And yeah, so sorry, I just muted myself. That concludes the prepared questions. So now here is an opportunity for you all to either unmute yourself, raise your hand, type your questions in the Zoom chat box. We have a couple in the anonymous Q&A already, one of which is, would you say that pills are the best way of birth control if it is something that you can't discuss with your parents, since IUD and others require more? The question was cut off, but basically, maybe if you want to answer the first one, what would you recommend if seeking birth control isn't something that you can discuss with parents?
I mean, I think I'll hop in here. You know, we always say, what's the best birth control? Best birth control is what you want, right? It's not what I think or what Tanisha thinks. You know, it's important to think about what's most important to you. And that's often the question I would ask a patient, you know, first of all, you know, what do you want birth control for? Whether it's for acne, Alex, your skin looks lovely. You know, whether it's for acne, for cycle control, for heavy periods, pregnancy prevention. You know, if someone says to me, you know, the most important thing to me is X, then I might talk about that more. Not that I won't talk about the other ones, but I'm trying to listen to what that's most important to them. So if someone says, you know what, Kai, the most important thing is they don't get pregnant. I'm okay with other side effects, some irregular bleeding, what have you. I just cannot get pregnant. Then I might talk about and think about efficacy as the most important thing. And so when we think about efficacy, often, which we've talked about, the IUD implant, aside from that, you don't have to remember something, it's right up there with tubal ligation or vasectomies. It is the same efficacy, meaning less than 1 to 2 people out of 1,000 would get pregnant in a given year, versus something like the pill, which is a lot easier to get. And, you know, like you just mentioned, like maybe I can get it without even having to think about it, doing a procedure, what have you. But it's about probably anywhere from 7 to 10 people would get pregnant out of 100. Remember, I said 1 out of 2 out of 1,000 for the IUD implant, while it's about 7 to 9 out of 100 that would get pregnant in the pill. Why? Because the pill requires same time every day. And in perfect use, which nobody's perfect, as amazing everyone is, it's impossible to say, oh, 10 a.m. every day, 365 days a year. And that's why we see some people get pregnant. So you may often hear, oh, oh, my sister got pregnant on the pill. It's not that the pill didn't work, but her sister was a real person, and it's just hard to remember to take something the same time every single day. All that to say is, it's impossible to say what's best for you, as much as what you feel comfortable with. A website that we often, especially for young people, and I like it even for any age, is bedsider.org. Bedsider.org, Angela can put it into for us. They're just really good at providing good evidence, trying to be as objective, and then also just kind of speaking to you real about it. It's not very medical, but it's also very accurate. There's several websites that we can recommend, but that's a great one to explore. And just as an FYI, I wanted to bring up that I don't know if any antibiotics that really disrupt the efficacy of birth control anymore, besides rifampin. Rifampin is one of those that was originally used to treat TB. So it's not a very common birth control. Not a very common antibiotic. So there's not many birth controls today when we're thinking about the pill, the patch, or the ring that's disrupted by the use of antibiotics, just a FYI.
Thanks so much, Kai. Anyone have any other questions that they want to ask through Zoom, or remember the anonymous Q&A? Feel free to do so.
And also, can I jump in here while you guys are bringing up some questions? One thing I just want to bring up is EC, emergency contraception. I think it's one of those things that, even though it's been out for years, it's still kind of shrouded in a lot of mystery, because it's not super clear. Bedsider has some great stuff on it, but basically there's two types of EC, right? Either a pill, or you can get a Paragard IUD, which a lot of people go, what? So you want to take it as soon as possible, right? EC, there's two different types of pill. One is often called Plan B, but there's all sorts of equivalent to it, and it's all exactly the same. And that's available without a prescription, over the counter. Just so you know, you may go to your Jewel Osco and it might be behind where the pharmacist is, but if you feel boldened enough, you can still ask for it and get it without requiring a prescription or any age restriction. And that's to be taken ideally within 3 days after unprotected intercourse. Or when we say unprotected, it could be just, I was on the pill and I forgot. And did I take those days? Oh my gosh, I think I did forget this weekend. Oh shoot, I had sex last night. It could be that type of thing. Or maybe, a condom slipped. So it's not just necessarily, I didn't use protection. So EC pills, there's Plan B, and then the other one is called Ella. That one does require prescription. It's often advised, and that's good for up to 5 days after unprotected intercourse, but the sooner you take it, the better. And by the labeling, if your BMI, your body mass index, right, which is a number you may see, you can Google it really easily, what is your BMI. If it's above 25, we say the Ella is probably more effective in a lot of studies, and which a lot of people don't know, because then they just think, oh, I'm just going to hit Plan B. Oh, it didn't work because maybe it's less efficacious. And then the last thing is Paragard IUD, which can be used, and it's a great option for someone who's probably been thinking, I kind of am interested in a Paragard. I've been wanting something kind of long-term, and now I need emergency contraception. It's a great time to get it, and that's within 5 days after unprotected intercourse. And Juno for me also has a option. You can hit emergency contraception, and we can try to get you help. It's usually not immediate. It's not immediate, meaning within the hour or two, but we try to get back to you within 24 hours. Just a plug for EC as an option.
Fantastic. Thank you so much for that answer. We have a couple more questions in the anonymous Q&A. One of the questions is, would this workshop be recorded and shared with us afterwards? Smiley face.
Yes, it will be. It will be posted on the Chicago Student Wellness YouTube, and if we can figure it out, the Instagram as well, through Instagram TV, but you'll definitely find it on the YouTube. It's being recorded now, so don't worry.
Perfect. So another question that we got is, how many days can you forget to take your pill and be safe?
I'll take a step. So within 2 days, I tell individuals they should kind of use backup emergency contraception, as Kai said, because the birth control pills, you need to take it at the same day every time, because the half-life and the length of time that is effective is really, really important. So anytime you miss one pill, I tell them once they remember, they can take the next day and then the day that they're on. But anytime you miss more than 2 pills, it's no longer effective.
Right, and I think it's in fact, make sure you can continue taking that. If you skip more than 2, you could just skip it and just take the one that you're supposed to take, but then use condoms until your next withdrawal bleed, or don't have sex until your withdrawal bleed. And then when you start again, you're fine.
Another question that we got is if you guys can briefly describe the process of putting in the IUD. And this person says that they're a little scared of it.
Yeah, I mean, I think, it's very normal to feel nervous. I also want to mention one thing is, you don't need a cervical exam, meaning a pap smear, or pelvic exam necessary to start birth control, first of all. But of course, when we're looking at IUD, you will need to remove your pants and feel like you're going to get a pap exam. Many of you guys don't need your first pap until you're 21 years and older. Pap is a screening for cervical cancer. All that to say is, it varies. I feel like based on your provider, I have to, from my years, if somebody's really fluid at it, it's going to be a lot quicker for the most part. There's always going to be some, aberrations on the side. But you lie down, often your legs may be in something like a stirrup type of position. Oftentimes they may offer you, explain. Some people want to hear exactly what's going to happen. Some people say, don't tell me anything, just do it. So we try to respect that. You insert a speculum. It could be a metal or plastic thing. The speculum goes into the vagina and we open it up so we can see your cervix. Sometimes to find that cervix can mean the speculum, you have to move a little because everyone's anatomy is different. I say it's like ears. Some stick out, some stick in. So you might feel a little discomfort with that speculum. I often try to people, the more you relax, it's easy. It feels less painful because otherwise if you tense up, it feels like you're almost getting a cramp in your vagina. It's the best way I can explain it. And then, we clean off the little speculum with a cotton swab and some kind of betadine, the antiseptic. Some people just touching the cervix can make you feel like you're having bad cramps. Some people say, I barely feel it. So that could be across the spectrum. And then we measure your uterus. We want to know how big is it? Average uterus, 6 centimeters, 8 centimeters, 10 centimeters. It varies, again, like our ears. So that way, then once we measure it, and sometimes, again, when we're touching that cervix and measuring it, it's this tiny little plastic or a little tiny metal thing to measure it. It's like a ruler to say, this is how long your uterus is. So I know how to set my IUD placement. So I know how far to go in, right? And so all that process, oftentimes it could be, oh, I just feel like some cramps. And other people said, oh my gosh, that was the worst pain of my life. So I'm not going to sugarcoat it and say, oh, it's fine to everybody. But I always do remind people, it's short-lived, meaning the actual insertion once we get it in. And often, again, if you go to a skilled provider, that really helps it versus somebody who's new. And we all have to be patient with everyone's new, just to put that out there. But, it could be within a minute or two, I can be done. Boom, it's in, pull it out, we're done. Cramping can continue. Like Tanisha mentioned, sometimes we recommend ibuprofen, 400, 600 milligrams before you come, like an hour before that visit can help a little the cramping. And then you may take Advil or Motrin or your drug of choice for up to 24 hours, up to a week afterwards with cramping. It just varies on the individual.
One thing I just want to piggyback on is that what I find in clinic, the most painful part people talk about, Kai demonstrated that I was walking through the steps, and when we use the tenaculum to kind of open the cervix a little bit, that's when they kind of feel the most discomfort, I hear. And so just want to mention that.
Great. Thank you guys so much for your input. And that was super, super helpful. We had one last question, though feel free to send any more questions into the Anon Q&A or the chat box. The last question is there a way to see birth control options with my insurance in my home state?
I mean, I think if you have insurance, and it depends on what you're looking for, whether it's a pill, the patch, the ring versus a procedure, right? If you want something sent to your house, there is a lot of online options. One that we particularly like, because right now we're kind of in a soft partnership because we believe we like their mission, meaning their mission isn't just to make money, which we understand businesses do, but they believe that everyone should have health access to all forms of birth control without cost barriers. Is 28health.com. Again, we have no other shares. I'm not getting money from them, but 28health.com, and maybe Angela, you can write it out, is, you know, someplace that you can go online, you can do a consult. The consult's anywhere from $15 to $30, I believe, and they get insurance. They can just send it directly to your house. There's many others, about 10 to 15 other direct to door delivery services, and they cross state. Many of them cross state lines. The biggest one is probably Nurx, NURX.com, or the Pill Club. Again, I'm not endorsing anyone, and like I said, we are just 28 Health is kind of in a soft partnership right now with Juno for me as we're exploring some digital innovations, especially around pill, patch, and ring, and EC.
Yeah, so specifically regarding the question, I just looked on 28 Health and they have a very clear list of the insurances that they accept. So hopefully that option is a little bit more out there.
Gonna give a couple more seconds for any questions people want to send in.
I just want to say, Kai, it's so great to see you again. You're so amazing. I have the utmost respect for you, and thank you so much for your time. You're great.
Oh my gosh, I was just about to say that about you. And it was great to get to see you again. And I hope this was beneficial for all the students. And I think, you know, you guys know how to reach Tanisha. You have the pleasure of being able to find her on campus. I'm going to put in my email. And also, Angela, if you want to put in your email, we do have some volunteer opportunities for young college students or young adults. If this is something you're really passionate about in terms of reproductive health, the reproductive equity, that's me. And then Angela will put in her email as well. But yes, pleasure, Tanisha. I appreciate you saying that.
Looks like we have no questions being sent in as of now. And I know we're over and I want to respect everyone's time. Thank you so much, Kai and Tanisha and Marta and Kat and Sophie who have helped in InTouch create this event for us. Really appreciate everyone's effort and time, and Tanisha and Kai, thank you so much for your incredible expertise. We can't tell you how much we appreciate it, and this is such a needed panel that I think has been so much more than I could have expected. So thank you so much, really.
The pleasure's been mine. And again, it's an honor because I've been working with her or knowing about her work for so long. And I hope you guys connect with her and follow her because she's awesome. Thank you for all your work. And it was great meeting you guys today. And I hope I can cross paths with you in the Student Wellness Center.
Yeah, thank you all. Thank you so much.
Bye.
Thank you so much.